Welcome to UrbanEx Real Talk Fitness Radio News, where we don't bring you just the trending news, but also the news you need to know to assist you in making healthier choices for yourself in the hopes that you will be successful in navigating the often murky waters of the health and fitness industry. I'm your host, Tiaja. We'll be back next week, but as promised, each month we're going to veer off the beaten path and offer you something a little bit different. Today I'm going to touch on several stories. The first promises to move you emotionally while giving you pause as you recalibrate, that is, rethink what's truly important in life. We also examine a silent killer that is literally claiming the life of men, and no one is saying a thing about it, which begs a question: in an information age, how is that possible? It is Tuesday, June 4th, 2019. Let's flow. In our first story, we take a look at the tragic death of two young men. The first, Daniel Wright, a former contestant on The Biggest Loser, who tragically died this week at the age of 30 after being diagnosed with cancer. The second is Matt Porter, who died on May 30th at the age of 34. His cause of death is listed as heart failure, though on multiple occasions Matt Porter had contracted pneumonia, though his doctors told him he just had a bad cold. These two tragic stories are not an indictment on the fitness industry per se or medical malfeasance, as much as they are about the risks we are willing to take to achieve the illusion of fortune, fame, or just happiness.
Biggest Loser contestant Daniel Wright has died.
Yes, he first appeared on the show when he was just 19 and lost 250 pounds before ultimately losing his battle with cancer.
My name is Daniel Wright, and I'm from North Carolina.
The Biggest Loser family has lost a beloved member. Daniel competed on seasons 7 and 8 of the NBC show. Several of his former castmates shared the sad news that their 30-year-old friend died this past weekend after a battle with leukemia. Daniel was first diagnosed in 2017 and underwent chemotherapy and dozens of blood transfusions as part of his cancer treatment.
There's so many reasons why it's important for us to be here right now.
Back in 2009, Daniel shared why he wanted to be on The Biggest Loser.
The fact that I've been overweight my whole life, and recently I've really allowed myself to let go and to hide behind my weight and to get to a point where it's really unhealthy, and just for a long time I've ignored my health problems, and so I came here knowing I had to do it.
What's going on, guys? Nick Trugilli here from Generation Iron, giving you guys a report on something that I never thought I would be doing. Now, is the passing of a very close friend of mine, Matt Porter. Well, the first thing I want to say is my prayers, my sympathy, my love goes out to Matt Porter's family, his wife, his son, his immediate family, her immediate family, and I wish I could take some pain away for you guys, because I can't imagine, I could never fathom what that feels like. I really can't. And to see his newborn son, not know what's going on, not be able to meet his dad, it just breaks my heart, and the reason you guys didn't see this video immediately is because of A, I'm going to show respect to his family and not just rush and make a video, and B, I wasn't able to make a video. Yesterday was, and just report what I have to do and do my job, and my job is to clear the air on all the crap and speculation that he died because he did this and that and he's reckless and he does that and does this. No. That's not going to happen to somebody I know who was very meticulous about his health. Listen, guys, it works like this. We're all in this sport called bodybuilding. We're all playing Russian roulette with our health. Some of us last longer than others. Some of us obviously don't have as good as luck as others. Matt did not do anything by any means to cause this directly to himself. This is what we get when we play with fire. Some of us are able to last longer. Some of us aren't. Matt was so on top of his health. It was nothing he could do to be any more on top of his health. He was literally waiting for a CAT scan to get back because they found something on his lung, like a mass of some sort. He knew he had an enlarged heart. This was not a secret. This is just what we're playing with, guys. We have to be careful. And I'm saying this in the utmost respect for Matt, because he would understand 100% what I'm saying right now, is that you can't predict this stuff. This could happen tomorrow to any one of us, and we have to cherish every day on this planet, especially We're walking the fine line of using chemicals like steroids. Matt went off everything for a reason. You know, he had other things to attend to in life and went back to the sport because he has such a love and passion for bodybuilding, as do I. Matt loves to work out. Matt loves to pioneer new ways to use things and chemicals and his supplement brand and his coaching. He is a genius. Do you really think Matt would be that reckless to let something like this happen to himself if he could have? No. So do not blame it on Matt. This is just what we're playing with. This is real. If you don't understand that, then you better now. If Matt wasn't a close friend of yours, then someone that will be closer friends of yours will happen to him. It will happen to them eventually. It's inevitable. I didn't think it was going to happen to me either, and all of a sudden 3 years later, 4 years later, I got like a double digits of deaths around me. It's real life, guys. You're playing with fire, so please. Older guys, young guys, middle-aged guys, if I'm talking to somebody, whatever, never even used steroids before, maybe you're a healthy guy, doesn't even go near that stuff. Maybe you're a natural bodybuilder. Still get your health checked. I'm not going to say it again. There's no reason for we lose somebody at 34 years old like this.
In our second story, we talk briefly about the differences between aspirin and ibuprofen and when to take them. Both are over-the-counter medications. Both are non-steroidal and anti-inflammatory drugs, pain relievers that have been on the market for years. The two are similar, but according to the latest research, certainly not interchangeable. Take a listen.
So many people have pain, and pain can be helped by medication. But there is no free lunch. Every medication that you take will have some side effects. So let's look at those. Number one, regular old Tylenol. Tylenol is a good pain medicine. It doesn't work against inflammation like pain in joints. But for pain and headaches, sometimes it's a very good medication that you can use. If you use too much Tylenol, it can cause some liver disease. If you're using more alcohol than you should and you use Tylenol, it makes it a greater chance where you'll have serious liver disease. If you get liver disease, your eyes can turn yellow, your skin can itch, your skin turns yellow, your urine turns Coca-Cola colored. Be careful with Tylenol. Look at all the different medicines. Look for Acetaminophen. Don't overuse it. Next is the NSAIDs. We've got aspirin and we've got ibuprofen. Let's talk about aspirin first. Aspirin's a great medicine. Not only does it work on pain, it works on inflammation. And so if you've got arthritis, aspirin is good for that. If you've got anything that's causing irritation of a joint, aspirin's very good. It works against inflammation, it works against pain. Side effects, it's really hard on the stomach. Some people can get GI bleeding with aspirin. Some people who are allergic that have nasal polyps and have asthma, they can have a severe allergy to aspirin. If you're younger than age 15, if you're a child, aspirin with fever, not a good medicine, or for pain, not a good medicine. There's a neurologic side effect called Wright syndrome, so you stay away from aspirin if you're young. Then we get to the ibuprofen family. They're wonderful, they're good on pain, they're good against inflammation, they do a great job, but they also bother the stomach. So if you've got stomach problems, be very careful. If you use ibuprofen medicine and they work real good, be very careful about using them for too long a period of time. Because if you do, they begin to bother and damage the kidneys. You can get high blood pressure from overuse of ibuprofen or Aleve or that family of medicines. Talk to your pharmacist, talk to your doctor. If you're using those medicines more than you should, be sure that your doctor knows.
At age 53, Lisa Rustin slipped on a Del Mar, California sidewalk and fractured her arm. A bone density scan recommended by her gynecologist because of her family history of thinning bones revealed osteoporosis. She threw away her high heels, quit downhill skiing, overhauled her diet to include more calcium-rich foods, and started walking with a backpack filled with books. See, weight-bearing exercise is an important way to strengthen your bones. Rustin also began taking calcium and vitamin D supplements and a biphosphonate drug, the most commonly prescribed osteoporosis treatment. Of course, course, wearing high heels and low vitamin D aren't the only surprising osteoporosis causes. The term osteoporosis literally means porous bone, which arises when bone cells that break down are not replenished by new ones. That causes bones to break more easily and takes longer for them to heal when they do. There has been a plethora of information to reverse the onset of osteoporosis targeting women, but new studies show that more men are getting osteoporosis than ever before, 1 in 4 to be precise. Please share this report with all the men in your life.
Chances are you know someone who's dealt with osteoporosis, but when you think of that person, are you thinking of a man? Osteoporosis might be thought of as a woman's issue, but men are twice as likely to die from complications related to it. So how do you spot the signs and, more importantly, avoid the disease? One doctor says it's as simple as 1, 2, 3. Gary Clemens has been walking ever since he started chasing his big brother's shadows.
And they said either you keep up with us or you get left behind. What do? You learn to walk fast.
But these days, the 62-year-old has a different reason to keep up. He's trying to stay on top of his osteoporosis.
You got a lower disc in your back that's decaying away.
So every day,
It's good for you. It keeps you in shape, keeps you in good health.
Gary walks to support his back and his bones.
This is where the fracture is.
Dr. Arun Mova says Gary is a prime example of a disease that's on the rise.
Every day I see at least one osteoporosis patient. Yes, at least one.
Osteoporosis can be a complicated diagnosis, but the short version is it's a disease that makes your bones weak and more likely to break.
It's a silent disease, meaning you don't have any symptoms until you break a bone.
But you might have noticed that the literature, the meds, and the ads are all geared toward women.
5'4". Oh no, I'm shrinking.
There used to be somewhat of a stigma thinking that osteoporosis is a women's disease and it's related to menopause, But now we know more about osteoporosis, especially in men, and we are finding more and more bone loss in men compared to before.
Dr. Mova says men might need to actually be more aware of osteoporosis. That's because 1 in 4 will break a bone after they reach 50. In fact, men are more likely to get osteoporosis after that age than to get prostate cancer. And the scariest part is men are more likely than women to die within a year after breaking a hip due to problems related to that break.
We don't know why exactly that happens, but that is the most concerning part of this whole thing.
Fortunately, there are new medicines to help work on the problem. One actually forms new bones, others prevent bone loss. And there are things you can do now to keep bones healthy later. Dr. Movo says 1, get calcium and vitamin D. 2, stop smoking and limit alcohol use. And 3, do weight-bearing exercise like running or something a little less strenuous.
I will let them a lot of walking this winter.
Any kind of walk is good for the bones.
Just like Gary's choice.
Just walking around and just doing my exercises.
And following those simple steps.
I'm hoping I last as long as my mom is lasting.
Could mean a less painful route later on down the road.
And she's still going strong.
And again, Dr. Mova stresses this is a silent disease, so he says it's a good idea once you reach a certain age to start getting a bone density test along with some of your other routine ones. When you begin those really depends on you. As always, he says, talk to your doctor. Joy Howe, CBS 2 News.
Now, here are my 2 cents, and feel free to keep the change. In America, we take for granted the right to life, liberty, and the pursuit of happiness, but it is happiness that seems to elude most Americans. For example, we have touched on the growing prescription drug problem in America, as well as the preeminent suicide rates amongst young people. In previous episodes, we have also discussed the fact that Americans are living longer, yet it would seem that having longer life or the liberty to pursue happiness doesn't guarantee an increase in the quality of life or happiness itself. Medical checkups and early detection have in many cases led to more effective diagnoses and treatment of a disease. Still, the emotional side of the human being and its contribution to the overall health is too often disregarded. Keeping it real, there are a lot of unhappy, angry, and disgruntled people in America, and though the lion's share of the blame has to lie with the individual, it would be disingenuous for me to suggest that there are not forces out there whose sole purpose is to create a more distracted, narcissistic, weaker, compliant human being. When we allow for the commercialization of health by by the fitness and medical industrial complex, then we are complicit in our own unhappiness and confusion. No one wants to talk about emotional health because it's too difficult to diagnose and thus treat. So it's up to you and I to be proactive in our health, not just our physical appearance or yearly checkups, but in our day-to-day care of our whole being, our whole selves, mind, body, and soul. There's truly nothing new under the sun.